I'm Andrew Brzezinski. I'm the Vice President of Commercial Market Sales at SiteLogic. Facility resiliency is really the lifeblood and the ability to operate when things go wrong. How can we have uninterrupted control of our building during a severe weather event or a grid outage? It's a life safety issue. You cannot care for your patients the way you need to without focusing on the resiliency of your infrastructure in your buildings. If you're a patient, you need to make sure that the room and the facility that you're in can operate for you to receive the care you need. Also for the caregivers, the clinicians, in a lot of scenarios, when there is an outage, they're focused on responding to that instead of focused on the patient. There's a lot more urgency around this in the recent years. What started as really a mission-driven project, there's been such financial gains from it, and we can think about where our healthcare systems are at today, really trying to manage the financial pressures because they operate at such thin margins that they can't have these emergency projects pop up that really drive them to go broke in a lot of scenarios. The events that have caused facilities, specifically in healthcare, to focus on resiliency measures can be a number of different things, whether that be heat waves or severe weather, ice, snow. Our built environment is aging. It's less expensive to update a building than it is to build a new building, and real estate is at a premium, so in a lot of cases it's a financial decision. And with aging infrastructure, a lot of times our facilities departments and folks are not getting the capital they need to keep up with the modern needs of that building. The top 3 projects for energy efficiency or the quickest payback, LED lighting and controls is the easiest one, fairly low cost with a substantial energy savings component to it. Building automation system optimization is one that's often overlooked, but can have a major impact just by setting your set points to be more efficient and tightening those up can make a really big impact. And then HVAC retrocommissioning is another thing where people think about their HVAC systems and really upgrading the equipment and the hardware, but retrocommissioning them to have tighter set points and to make sure that we have different things that really hold together, like occupancy. If no one's in the wing of a building, we can pull those set points back to become more efficient. The focus there is really around stabilizing your energy costs. Right now across the country, we see energy costs rising, double-digit percentages. And if you can really come off the grid, that helps you stabilize your operational spending on utilities. The cost of doing nothing in these scenarios is massive. If you're a healthcare facility, that is not an option. If you can't insulate yourself from those severe weather events, your patients will suffer. And in healthcare, the most important job you have is your patient care. Hospitals and healthcare facilities are the anchors of their community, and people look up to them and revere them. And if you can't provide the care that you're supposed to provide, you get a bad reputation, and patient expectation is a very important thing right now. There is no waiting out rising utility costs. They are getting notices every single year from their utility providers that rates are going up. And with ultra thin margins in healthcare today and decreasing reimbursement, they have no option other than to address their operational costs. The climate risk is real, whether it's extreme weather events or grid outages. We all should be thinking about how we become more resilient in our facilities to continue operations without interruption.